safe motherhood, safety of the mother, birthing lady. We give lot of importance to that. In age old days, see, pregnancy, delivery is natural process. Okay, it was just like a lady was married, she became pregnant, she delivered. It was like that. But these days, becoming pregnant itself is after treatment. It has become a fashion. After marriage, you go to the infertility center, you get a baby into your womb, and then you go for a delivery. So this is how pregnancy, delivery, which was natural, has started coming into medical field. It is something like medicalization of a natural process. Now, why are we all entering into this way? Why are we not remaining silent? First is anxiety. If we think today we have to get a thing, we slog and we achieve it. From plus 2 marks வாங்கிறதுலேருந்து காலேஜில் அட்மிஷன் ஆகிறதுலேருந்து பொண்ணு பார்த்து கல்யாணம் பண்ணுறதுலேருந்து எல்லாமே we slog to achieve our aim. So now we are all used to that slogging. Even pregnancy and bringing out a baby has become a targeted job for everybody. Another thing, in the busy lifestyle, they don't have time. It was just a dictum, baby is result of happy married life. Nowadays, baby is not the result of happy married life. Baby is a result of expensive managements. If you have lot of money, you get the baby. This is what is happening. People who are for becoming pregnant, now that you are pregnant. Another thing, it becomes very precious. One of the person has come and told me, டாக்டர், நாங்கள் 10 லட்சம்லாம் செலவு பண்ணிட்டோம் டாக்டர், இவ ப்ரெக்னன்சி வரணுங்கிறதுக்காக, இந்த பாப்பாவை எப்படியாவது என்னை காப்பாற்றி கொடுங்க அப்படி கேட்குறாரு. See, he can ask me, this is my baby, you save the baby and give me. His mentality is, he has spent 10 lakhs for getting that baby, so he wants that baby very safely out. So this is another attitude which we face in the public. Another thing, sophisticated lifestyle, the comfortable lifestyle which girls are used to. They are not at all tolerating single uterine contraction. Those days, ladies used to just birth like that. Now it has become so much difficult for them. They don't have tolerance, they don't have patience to wait until the baby comes out. They become jittery, they start anxiety. Another thing, we keep husbands in the labor room, we keep family in the labor room, they feel very comfortable that way. We have to counsel everybody during their antenatal visits. Pregnancy is something that is enjoyable. It should not be something that is a burden for the family. Pregnancy is an experience which only lady can have. No man can have the pregnancy experience. No man can feel the baby move. Each and every minute of pregnancy, you have different experiences which you have to learn to understand the change and enjoy it. Then the pregnancy goes smooth. And during pregnancy itself, we prepare the lady each visit for taking her labor pains. We counsel them so that they never feel it as pain. They feel it as a pressure that pushes the baby out. This helps a lot. They are also taught about relaxation, breath holding, and how they have to tackle that labor pain. Other option, we have painless labor options. So in painless labor options, we give medicine into the spinal cord so that they don't feel the pain of contraction. The contraction keeps on happening. What is contraction? They should understand that uterine contraction is nothing but a sort of pressure sensation which tries to pushes the baby down the birth canal. Without force, the baby cannot come into the birth canal. And all this, why this cesarean அப்படிங்கிற ஒரு கான்செப்ட் வந்தது. One is because our pelvis, we are now used to walking. We were before four-legged animal. So deliveries might have been easy for the four-legged animal. But for us now, we are walking on two legs. The hips are compressed. The baby's head size diameter is more. You cannot push something which does not fit into the pelvis. If you are going to push something that is not fitting into the pelvis, we'll face problems. The baby will face problem, it will get stuck. One thing. Another thing, gadgets. Initially, we never had any method of monitoring the baby. Only the pregnant lady can say, my baby is moving, my baby is well, like that. Then came our stethoscope. We were hearing the fetal heart rate with this, and only that particular doctor can hear it. Now we have Dopplers. So even during antenatal visits, we place it in the mother's tummy and we hear the baby heartbeat bounce. So that shows the rate. Okay, we need the rate to be fixed somewhere between 120 to 140. If the rate is going to fall less than 100, or if it is going to be more than 160, the doctor becomes jittery. By more than the doctor, the attenders who are there, they become more jittery. We have continued fetal monitoring by CTG in the labor room. Even that we are allowing the attenders to see, they also know that the baby is safe inside the mother's abdomen. When the baby is safe inside the mother's abdomen, there is no need to bring it out by cesarean. If the baby is facing distress, actually by nature, baby can survive under very low oxygen level, not like adults. Even adult cannot survive that low oxygen level. A baby can prolonged survive low oxygen level. During uterine contraction, the blood does not flow to the baby. It stops. When the contraction goes away, the blood starts to flow. So during the time when blood does not flow, the baby survives well. That is because it has the capacity to survive under low oxygen tension. So when the extent of monitoring is such that even small minor changes in the baby's heartbeat will be able to follow. Next comes our normal delivery. Okay, normal delivery, what is the concept? Normal delivery means the mother should be delivered of a well baby, healthy baby, and the mother should not suffer any damages to her birth canal. So this is what is called normal delivery. Just the baby, a brain damaged baby, being pulled out with an instrument from the vagina, causing tears of the vagina and other serious problems of fecal urine incontinence in future cannot be considered normal delivery. Another thing, coming to the rate of cesarean sections. Rate of cesarean section varies from institute to institute, and the stigma is it is in the hands of the treating gynecologist. It can see all gynecologists want vaginal delivery. They want the baby to come out naturally. They are not interested in cutting the tummy and taking out the baby. But at unavoidable circumstances, they are forced to do it. So it depends. Like in an institute which has only high-risk patients, people know that this hospital, high-risk patients, high-risk deliveries, facilities are there. So they swarm into that hospital.